Hi, welcome everyone to the podcast series on innovative healthcare solutions, sponsored by the Conference of Consulting Actuaries, or CCA. My name is Ed Pudlowski, and I'm president of Morningstar Actuarial Consulting. I'm also the chair of the healthcare community within the CCA, and I'm going to be your host for today's discussion. Now, these podcasts are a series of interviews with actuaries and other professionals focused on delivering innovation in healthcare. These sessions are offered to provide insights about what's transpiring in the ever-changing healthcare environment in which we live. I'm sure we're going to be delighted with this session today and the great discussions we've had to date. You can go back and via the CCA website, find some of the old ones. And I'm sure you're going to be delighted about the ones that we plan to have. They're highlighting the interesting people, products, and services that are designed to drive a better healthcare system. So I'm delighted today to be joined by Trevor Fast. Now, Trevor is a fellow of the Conference of Consulting Actuaries, a fellow of the Society of Actuaries, and a member of the American Academy of Actuaries. Trevor is also the chief actuary for Bind. Trevor, thanks for joining us today.
Thanks for having me, Ed. I'm excited to be with you here today. And you mentioned that I'm the lead actuary at Bind. That's actually a little bit out of date now over the past couple of weeks.
I was going to ask you about that.
Yeah, so we just have undertaken a rebrand. So we are now being known in the market as Surest, as in the superlative of certain, which really relates to our value proposition that we aim to deliver to our members and our employer clients. And this really originated back to about just over a year ago. We became a subsidiary of United Healthcare, and so for a number of years now, even prior to that, we've had a deep partnership with them on multiple fronts, including use of the network, and now as a subsidiary. We have an even deeper partnership, and there was a need to kind of reinforce our value proposition and rebrand as we face out to the market as Surest.
Great. Well, thanks for that correction. It sounds to me like that only is going to provide you with stronger support in the market, but really doesn't change much about what you're about. Why don't you give us a little bit of background on what Surest is? I know you're a health plan offering, but maybe you can help our viewers understand the difference between what you offer and kind of the traditional employer health plan that exists out there.
Sure. So when we started about 6 years ago now, 6 years ago was the kind of in the garage phase of the company development. By 5 years ago, we had just gone live with our first members, those being ourselves, and we came about because we identified that there were severe dysfunctions in the healthcare market. No surprise to any of your viewers. And we were pretty dissatisfied with the solutions that we saw being developed in the sort of post-ACA era landscape. And the one thing that really wasn't being innovated on was the actual benefit. So there was a lot of network innovation happening. There was a lot of innovation around member service and navigation, but there wasn't innovation on the benefit itself. And even today, we live in a world that is dominated by the HDHP benefits that were invented 20 years ago. And I was just looking up. I did a Google Scholar search. I was looking up what were the articles that were written about HDHPs in 2004. And HSAs, and they're all full of peaches and cream and promise and hope. And then I did a search on what's been written, what's been published over the last year, and it's they're regressive, they are inequitable from a DE&I perspective. They are, they're people are not actually finding the ability to act against this now cost-efficient marketplace and discover high-value care, and people are not actually saving for the most part, or at least it's very segmented by wealth disparity, the degree to which people are actually able to save and invest in HSAs. So, when we look at the promise versus reality of HDHP HSA model, we said there's a gap, and one of the key points that the consumer-driven revolution did not fulfill was that the promise was we were going to enter into this era of provider price transparency. We were going to have a well-functioning healthcare marketplace. Providers would compete on price, and consumers would be able to act against that. That obviously hasn't happened. In fact, recent developments on the legislative front are trying to push the market more actively down that path. But we said there's actually a better way. Let's get rid of all the fuzzy math to consumers. Let's eliminate deductibles. So another mini tangent on deductibles. So let's take a step back as a profession. Where did deductibles come from? Well, healthcare didn't invent them. They came from the P&C world. P&C invented the deductible. And deductibles were meant to apply on a per loss event basis. We don't have annual deductibles in our auto insurance or our homeowner's insurance because fundamentally annual deductibles actually make no sense actuarially. Deductibles only really make sense on a per loss event basis. And that's how they're applied in P&C. That's how they were invented. We've sort of accepted them as the water we swim in healthcare, but we don't have to. And if you actually applied them on a per loss event basis, we'd just call it a copay. So we decided to kind of go back to first principles and redesign a benefit around, we can give people prices for per loss event, meaning per use of the healthcare system, whether for a specific service with a specific provider. We now have, we're at a unique time where we have access to the data to be able to pull this off. And so we eliminated deductibles, we eliminated coinsurance, anything that causes the consumer not to be able to know what their cost is in advance of use. And we replaced all of that with cost-certain copays. And so our partnership with United really gave us access to both the network as well as, really crucially, the data to be able to put price tags on everything. So we put price tags on literally everything in the healthcare benefit. There's no deductible, no coinsurance in a bind or surest benefit. And so that's really kind of at the core of our philosophy is let's redesign the benefit around the consumer first and foremost, and then support that with the navigational tools, the digital tools that they need to find better, clearer answers about their costs and coverage.
So Trevor, you made an interesting comment there, which is that you've put a price on all services that exist out there. I know a lot of organizations will select certain ones, carve out maybe your elective surgeries as an example and have set prices for those, but you've kind of taken this much further. Truly, have you covered a kind of an all-in price for any service anybody could get within kind of their kind of the frame of a healthcare insurance solution?
We have, and I guess I should have mentioned as well that this is where we sit in the healthcare landscape is as a sort of full stack health plan solution. So we we are offered to large employer groups, anywhere from 51 plus to about 20 of the Fortune 500 as we stand today. And we were offered on their benefits administration alongside the BUCAs and other regional carriers. So we did put a price tag on everything. Now, in some cases, that means so we have specific price tags on obviously an office visit is going to have a copay. Now that office visit copay depends on the practitioner you go to, because we wanted to sort of marry the best of the intent behind consumer-driven plans. The intent behind deductibles and coinsurance is let's nudge people to use more high-value care. We can still do that in a copay model, but we have to be able to do the heavy lifting on their behalf and give them a price tag in advance that signals where they can discover that value. So you might see, for example, I'll sort of make up a plan design. You might see an office visit range from $10 to $60 in copay, depending on the name of the practitioner. And if you use the app, website, or call member services, you can discover the specific copay for a named practitioner in the network. So office visit is kind of an obvious one, but we extend that to, we can give you a specific price for a knee replacement or a hernia repair or a gallbladder removal. Anything that's covered in a comprehensive medical benefit is covered in one of our plans, and we give you a specific price for everything. And it's all searchable through a sort of modern app-based interface.
Right. So, and how does, so we can understand based on selecting a certain provider, what my copay may be. How do you help the members of a Surest plan understand the quality of the provider so they can kind of balance price with quality?
Yeah, it's a question we get probably at least daily, probably multiple times a day. So
you have an answer to it, and I didn't catch you off guard, if that's what you're saying. Right?
Never thought of it before. So a couple of things we do, and I should probably first point out that quality in healthcare is actually not very well defined. We all talk about it, and we seldom mean the same thing when we say it. And so I think we recognize some of the gray when we talk about this domain, but we also want to signal to our members where we know high quality does exist in the system. And so one of the great benefits we get from our partnership with United is the premium designation program that they use to qualify the degree of quality care delivered by physicians in the network based on their effectiveness and dozens of nationally established sort of well-known quality metrics from the usual suspect organizations. So we display that symbol alongside the copay price tag to our members. We display a heart for those that have achieved the quality care designation under the United Healthcare Premium Program. So that's one. Secondly, and probably just as importantly, is that we actually embed quality into the price tags themselves. So when we set those price tags to nudge people to high value care, notice that I didn't say low cost care. We really want to be encouraging members to use the high value, and I mean that in sort of the normal definition of high quality and low cost. When you put those together and you identify those who have lower complication rates, lower readmission rates, they use conservative treatment before they jump someone to a surgical intervention, which typically is going to result in members being happier and healthier. So we look at really that total episodic cost of care. How quickly do you restore someone to health and solve their condition? And of course, and I know you've talked with on some of your prior podcasts, which I was binge watching recently.
You might be the first to do that. I don't know. We'll have to give you an award for that, I think.
It was fun. I encourage everyone to do the same. Some great information out there. But these are really thorny problems, right? Identifying provider performance it's a highly multidimensional and sparse data issue. When you really think about trying to control for the patient base that every doctor is seeing, controlling for those that present with the same conditions, with the same acuity, and then sort of the luck of the draw of, well, can I really perceive when this, if I see an adverse outcome in this member, is it because the provider did something wrong, or is it because they were unlucky, or because the member didn't adhere to the protocol? So it's a big data problem. This is also why you're seeing some of these types of big data driven innovative solutions come to light now. We only now have access to both the data and the computing power and the techniques, as well as the fact that that consumers of nearly all socioeconomic strata, of all walks of life, are walking around with computers in their pockets. And a growing expectation that every industry is going to act on their behalf, like Amazon and Uber and name your favorite on-demand service, that I can get answers to how in healthcare, about how my costs and coverage work at the click of a button. So it's really interesting actuarial and data science work that goes into it. And it's a really big, hairy, big data problem.
So at the end of the day, Trevor, what's the value proposition for the people that purchase your solution, say, large employer and their employees? Because I'm assuming there's kind of a benefit on both sides.
Yeah. So it's manyfold. First is that because we designed the benefit around the consumer and eliminated all the fuzzy math, right? We give you a price for everything. It means that we actually have, I think of it as a higher degree of consumer protection than the CAA, NSA recent regulation provides for. Some of which says, well, if you search for J1745, I have to be able to tell you the price for that. Well, we don't think consumers should have to learn the CPT code book. And we think that if they go in for a knee replacement with an in-network surgeon at an in-network hospital, they should be protected against all the choices they didn't make about anesthesiologist and assistant surgeon and on and on. So we give them a single price for what they perceive as a single care encounter. So it's a really high degree of consumer protection against unexpected and surprise billing. We find that because we array prices against healthcare value, our members are spending $500 less out of pocket annually compared to the national average. And the total cost of care, because our members are using more high value care, and by the way, they're using 10 times as much virtual care as benchmark, it's lowering the total cost of care for the group as well. So when this is how a good marketplace works. When people make decisions that are in their economic and health best interest, it improves the pool for everyone. And so group premiums come down by 10 to 15% for an actuarially equivalent benefit.
Great. That sounds fantastic. I'm assuming too that you're evaluating these along other metrics as well in terms of usage. Maybe You talked about virtual care being greater than others, but, I'm assuming maybe, does it show up in other service categories like emergency, lesser emergency room visits and other areas?
It absolutely does. And part of the advantage of not having a deductible is you don't have people avoiding high value care because they're afraid of their deductible. And of course, you see it in high deductible plans, even though you've got $0 preventive, because if the doctor codes it in a slightly different way, it's not going to be $0 preventive anymore. So by eliminating the deductible and the fear factor around it, it actually it levels utilization across the year. There's no reason that we think someone should pay radically different amount for the same care in January versus December. That's not a rational concept. So it levels utilization, it levels spending, and we do see a lower rate of use of emergency room. We see a higher rate of use of things like physical therapy and virtual care. And then for those, when you control for any one of those services, we see a lower cost per service because people are using the more efficient providers in the network for that service. Great.
Well, Trevor, I always like to wrap up conversations with a little bit of a personal question, and it's always, if you didn't have this career in healthcare and as an actuary, what would you have done instead? What's your passion, or passion beyond your current skill that pays you dollars?
Well, hopefully you're not asking because I didn't come across as passionate enough in the course of the last 25 minutes.
No. Your other passion.
If you had asked me in maybe junior high, I would have said an astronaut. Until I realized that my eyesight and stature disqualified me, and then I would have said maybe mission control.
Okay.
I'll go with that.
Okay, that's cool. That's our first astronaut in our series. So I enjoyed that. Well, Trevor, thanks for doing this. I'd really like to encourage all our viewers who participate in our healthcare community continuing discussions about the insights that Trevor shared here and discuss that on the healthcare community platform. If you're not a member of the CCA and you want to consider joining to not only experience the benefit of the community platforms of the CCA for informal discussions, but also some of the other great benefits that our members enjoy. Trevor, thanks again for being here today and sharing your insights about what Surest is doing to drive innovation in healthcare. I know I benefit, and I'm sure our audience benefited as well. Thanks again.
Thanks so much, Ed. Enjoyed the conversation.
Me too. Thanks.